Hello and namaste, guys. I am Dr. Anushruti and I welcome you all to another enlightening episode of the Dr. Anushruti Show. Today, we have the honor of hosting a distinguished expert in the field of chest and respiratory diseases. I am talking about none other than Dr. Pawan Gupta. Dr. Pawan Gupta is a senior consultant at BLK Max Super Speciality Hospital in Delhi, and he brings a wealth of knowledge and experience to our discussion. Join us as we delve into the latest advancements in the respiratory health and explore critical insights from one of the leading voices in this field. Dear viewers, let's join our hands together to welcome none other than Dr. Pawan Gupta. Hello, sir. Namaste. How are you?
Namaste. Fine. Thank you very much for inviting me on this session. It's very important session on the disease related to the chest and respiratory disease.
Absolutely, sir. So, first and foremost question, when should one actually go and consult a pulmonologist? Everyone directly goes to the nearby doctor, but when should one consult a specialist, a pulmonologist?
So whenever anyone has any respiratory disease and the symptoms in the form of cough, breathing difficulty, or chest pain, basically these are the very common symptoms uh, which the common public comes to, like the breathlessness or the difficulty in breathing. So sometimes they say that they are comfortable while resting, and whenever they walk, whenever they go to the stairs, they feel difficulty in the breathing. So this is the most common problem or most common symptoms for which the patients come to us in the OPD. So this is the one symptom by which we should be very aware that yes, this patient may be suffering from some respiratory illness. Second, the symptom is the cough. I think no one is there in world where he has or she has not encountered a cough in his life. So, but the important thing is that there are two type of the cough. One is a very basic, the seasonal cough, right? Is season change हो रहा है तो उसमें cough हो गया. So in that condition, one need not to worry, and they should not be a panic mode, and they should give the time for the body to settle their cough. But sometimes what happen that the patients they tend to wait a lot time for and cough persist for a weeks and then months. Then they should consult a doctor. Any cough which is more than 2 to 3 weeks, they should consult a doctor. क्योंकि 3 हफ्ते से ज्यादा कफ टीबी भी हो सकता है, और इंडिया में टीबी बहुत ही कॉमन बीमारी है. सो टीबी अगर है तो उस कंडीशन में वन शुड कंसल्ट द डॉक्टर, और उसका सबसे पहला जो सिम्टम है वो कॉफ है. इसके अलावा अगर किसी को चेस्ट पेन है, तो चेस्ट पेन तो जनरली लोग सोचते हैं कि जो जनरल पब्लिक की ओपिनियन यही है कि चेस्ट पेन है तो इसका मतलब कोई हार्ट रिलेटेड इलनेस या एलिमेंट है. बट चेस्ट पेन इज आल्सो वेरी कॉमन सिम्टम ऑफ द रेस्पिरेटरी इलनेस. सो चेस्ट पेन अगर किसी को है, स्पेशली सेंट्रल चेस्ट पेन है, या प्लूरेटिक चेस्ट पेन मतलब कि अगर वो लंबी गहरी सांस ले रहा है और कॉफ कर रहा है और उसके बाद उसका चेस्ट पेन इंक्रीज हो रहा है, तो दैट कैन बी रिलेटेड टू दी lungs, or it can be because of the pleura, which is the membrane surrounding the lungs.
सर जितने भी व्यूअर्स हमें देख रहे हैं आई गेस आई हैव टू इम्पोर्टेंट क्वेश्चंस ओवर हियर हाउ कैन वन आइडेंटिफाई और डिफरेंशिएट बिटवीन अ रेगुलर कफ or a cough that is indicating to a serious respiratory issue. On the other hand, another question arises is how can one identify or differentiate between a regular chest pain or a chest pain related to heart or chest pain related to a respiratory disease?
Yeah, very good question. The first I will talk about the cough.
जी.
So regular cough जो है that is very common, and like suppose किसी एक person को अगर family में cough है और उसके बाद वो cough दूसरे family members को भी है, so that's mean that is either a viral cough or it may be a seasonal cough. So generally, these kind of the cough they settle down of their own within 3 to 4 days, and it does require only a particularly antitussives or cough syrups. But अगर किसी को कुछ cough है और that is related to some serious illness in their body like TB or pneumonia or asthma or ILDs, so all these disease they have the cough as a मोस्ट इंपॉर्टेंट सिम्टम्स। तो इस कंडीशंस में अगर किसी पेशेंट्स को कॉफ है और वो कॉफ persistent है, which is not going of its own, or despite giving the antitussive, or बाकी दूसरी family members they are all right, they are not having any kind of respiratory related issues, then they should consult the doctor, respiratory physicians, because their cough may be related to the some serious illness. Second point for the cough which is not regular is if it is associated with any sputum, like yellowish sputum आ रहा है किसी को cough के साथ, तो that is also an indication कि उसको निमोनिया या कोई लोअर रेस्पिरेटरी ट्रैक्ट का इंफेक्शन है। तीसरे पॉइंट, कॉफ के साथ अगर किसी को हिमोप्सिस, हिमोप्सिस मतलब कि अगर उसको ब्लड है, तो दैट इज नॉट अ नॉर्मल कॉफ, क्योंकि मैनी टाइम्स जस्ट स्मॉल टिंज ऑफ स्पूटम, अगर उसमें ब्लड आ रहा है तो दैट कैन बी इंडिकेटिव कि उसका जो कॉफ है दैट मे बी कॉज ऑफ द म्यूकस डैमेज, तो शुड नॉट वरी दैट। बट उसके अगर ब्लड बार बार आ रहा है, फ्रिक्वेंटली है और अमाउंट भी ज्यादा है, देन वी शुड definitely seek the doctor's advice. So cough which is having a purulent sputum, or it is having a blood which is persistent, and cough is not present in other family members, or it is not a seasonal, then this is related to the some serious illness and they should seek the doctor's advice. आपका जो सेकंड क्वेश्चन है कि चेस्ट पेन से रिलेटेड, कि इट इज रिलेटेड टू दी हार्ट और एनी रेस्पिरेटरी इलनेस, तो उसके लिए द इम्पोर्टेंट थिंग इज कि अगर chest pain which is more towards the left side and it is going in the arms associated with the sweating, so that is most likely because of the heart related ailments. If it is pleuritic chest pain means कि जो chest pain increase हो रहा है on deep inspiration or coughing, so that is related more towards the respiratory illness. And sometimes there is a central chest pain and it can be present in both respiratory or heart disease. But the central chest pain which is burning in nature and it is associated with GRD, then it is related to the stomach ailments, or it is because of the gas, acidity, or GRD. Important point for the respiratory related chest pain is that it is pleuritic chest pain. See, and a third thing is that chest pain also in the very young patients, like young patients or adolescents, ठीक है, जहाँ पे कोई कोमोर्बिडिटी नहीं है or any heart related disease. So then also first pointer is toward the respiratory illness. Like the person who is more than 50 year of age having diabetes, hypertension, hypercholesterolemia, मतलब cholesterol ज्यादा है, obese है, so then our chest pain है, तो firstly we should seek the cardiologist advice and they should do the ECG or echo. If that is clear from their side, then they have to go for the pulmonologist, so then we have to go for the x-rays or all. But if it is younger patients, there is no comorbidities like diabetes and hypertension, और चेस्ट पेन अगर करके आता है, तो फर्स्टली द pulmonologist will seek the will give advice and will do the chest x-ray and the PFT.
So we have a lot of audience here listening and viewing this episode, and I know most of them are kids. Kids, as in school-going students. You would agree to a fact that they are either not capable of taking out the sputum, taking out the cuff, or they do not wish to. Sometimes we do have examples. They swallow it, they chew it, but they do not just take it out of embarrassment or anything, but they do not spit it out. What do you wish to say to such people?
तो बेसिकली जो सबसे ज्यादा प्रॉब्लम जैसे आपने नोटिस किया कि जो किड्स हैं जो स्कूल गोयर्स हैं एंड दे आर नॉट एबल टू एक्सपेक्टोरेट आउट एंड देयर प्रॉब्लम इज दैट they continuously to swallow the cough, right? So in these kind of the children or the kids, firstly we should advise them to take the steam inhalations, because asthma is very common in the children's.
Yeah.
एंड एस्थमा अगर चिल्ड्रंस में होता है उसमें और साथ में जो पीडियाट्रिक ट्यूबरकुलोसिस है, दैट इज आल्सो वन ऑफ द कॉमन कॉज फॉर द कॉफ इन द चिल्ड्रन. In both of these conditions, we always ask for the children to expectorate out their sputum, because if they don't, and what happens, that will go inside, that may go inside the lungs or may cause the further infections. तो फॉर देम वी ऑलवेज एडवाइस कि वो एक तो स्टीम ले, और सेकंड इसकी हाइपरटोनिक सलाइन हम एडवाइस करते हैं। एक हाइपरटोनिक सलाइन होता है, दैट इज basically a higher version of the saline. So what it does that it basically it acts as a mucolytic agent। मतलब ये जो बलगम है या जो स्पूटम है उसको ये थोड़ा सा उसको पिघला देता है। तो उससे क्या है कि द किड्स दे आर एबल टू बेटर सेपरेट आउट द स्पूटम। So for these kind of the kids, my advice is to go for the pulmonologist and they and seek their advice like how to expectorate out. Definitely, physiotherapy has its own role, but from the medical point of view, there is no role for the medication. Only is the hypertonic saline or the saline.
Absolutely. Sir, this was all about kids, but now we have another population that is of adolescents. Now we have another population of well mature, very grown up people, people of even age of 30, 40, 20s. We have seen that out of embarrassment, they do not cough. They try to hold their cough even when it is at the peak. And even in leading newspapers like Times of India, Hindustan Times, we usually go through articles and case studies which says that this has even caused serious illness or shortness of breath, even death in some cases because of not having coughing in a regular period. What do you want to say about this?
Yes, uh, you are very clear, and the thing is that these kind of the adolescent, because of the issue of the embarrassment in the
Yeah.
public space, and if they have the coughing, so what they do, they sometimes suppress their cough. So what happens कि एक तो जब suppress करते हैं, so intrathoracic pressure it get increase, so it may leads to the pneumothorax। pneumothorax मतलब कि हवा भरने का रिस्क रहता है around the lungs। and second issue which may arise is the expectoration or the sputum, when they don't cough out, it may go inside the lung and may cause the pneumonia। and third thing is even it may choke the airways। तो चोकिंग जो समटाइम्स हमसे कहते हैं कि चोकिंग हो गई है, तो चोकिंग का रीजन यही होता है कि चोकिंग व्हेन द स्पूटम इट गेट्स स्टक इन द थ्रोट और इन द लोअर एयरवेज। सो व्हाट हैपेंस, दिस airway supply or the oxygen supply to the lower airways get blocked।
Your voice is not coming.
Now it is
Yeah, yeah, yeah.
audible।
Yes, yes, yes. It is audible.
So for these kind of the audience, I will suggest that they should not block their expectoration from coming out of the mouth. They should not be ashamed of the expectorations or coughing in the public, especially after COVID. The issue is more because people they are getting away from those having a cough for the fear of the transmission of the infection. But they those having a cough, they should keep with them the tissue, or they should keep with them their handkerchief, or they should wear the mask. So they will not, it's not a issue of the embarrassment, it is a issue of their own health। and because if they suppress their cough, what happens that they may get the choked, or the expectoration will not come out, and it may stuck in the lungs or the airways। Especially after COVID, the issue of coughing in the public has increased, and but the thing is that one should keep in the mind that the blocking the cough or the expectorations, it may adversely impact their health. So what they should wear the mask, and second thing is that they should basically keep with them the tissue, so that if they cough, the maximum just the sputum it will come in the tissue। So basic thing is that one should not stop or block their cough or their suppuration from coming out, because it may lead to the choking or incidence of the pneumonia। So for these kind of the people, I will advise to wear the proper size mask, and avoid going to the public place if they have the violent cough।
Absolutely. So moving ahead, I want to know one thing. Is every cough every cough, every type of cough is something that people should be distant with, because after COVID, people have taken it very seriously. Any of the family member who has cough, who has cold, eventually the other family members tend to make them isolate, not in that level of COVID, but yes, little bit of isolation is still there. वो उनको एकदम से अलग, उनका टॉवेल अलग, उनका हैंकी अलग. सो इज दिस अ गुड प्रैक्टिस कि हाँ कोई भी कफ हो, दिस शुड हैपन, or people can take it lighter?
See, if it is viral cough, right? So, and viral cough is very common, then this practice is fine because viral infection is that kind of the infections which spread like anything. If one family member is infected, there is a high chance of getting infection in other family members. So, for a community point of view, for the community prevention, the isolation of these kind of the patients who are having a violent cough is okay. But isolation in a proper manner, like if they have the cough and if they can wear the mask even at home, so why to isolate? So if they are able to wear the mask at home, so don't isolate them. If they are not able to wear the mask, then it is okay. Okay, so first thing is this. Second thing is if it is an allergic cough or a seasonal cough, because some patients they are having a issue of allergic bronchitis or allergic asthma. So in this case, there is a no risk of any communication to the or communicable to the other patient or other family members or other healthy people. So in these cases, one should not isolate. They can sit with them, they can eat with them, or do anything. But the thing is that one should identify the cause of the cough. Suppose if it is a infective cough, then definitely one need to be separated from the patients. But if it is allergic, then there is no requirement. So the segregation of the cause of the cough is important.
Absolutely. Sir, here I would like to welcome you to one of the segments of my show that is named as Ask the Doctor. I have a few questions ready with me, which general people have told me to ask you. I hope that you are going to answer it. So, the first question is coming up from Mr. Jayant Kushwaha from New Delhi. He says, "Hello, doctor. I always prefer to use Vicks VapoRub on my nose and throat when I have stuffed nose and cough. I also take a steam with Vicks VapoRub in it. But I have heard that Vicks is banned in many countries. So is it safe for me to take it to get better of cough?"
Uh, I think there is no requirement of mixed vaporub or any kind of in such kind of the ingredient while taking the steam because steam alone is more than sufficient. If you add anything, like some people they add the Vicks, some people they add the the haldi type of the things, right?
Yeah.
Ayurvedic things. So there is no requirement for that. Even the study says that if you add something of this kind, it may in fact irritate your nasal mucosa or the throat. So to prevent that, steam alone is more than sufficient because the whole purpose of getting the steam is to moisturize your the cavity so that the moist if you get the moisturize and so that your nose and your throat does not get dry. So if you add something, it may cause the adverse effect or the irritant effect that may cause the adverse effect on your health.
Absolutely. Moving on, we have Advesh from Chandigarh. He says, मैं मैं इनहेलर का यूज करता हूँ नोज में. यूजुअली मुझे कफ और सर्दी जुकाम रहता है, बट मेरे पेरेंट्स कह रहे हैं इनहेलर इतना यूज नहीं करना चाहिए, वरना मेरी नोज ब्लॉक हो जाती है. क्या करूं?
See, basically the issue is this is that is half knowledge is always dangerous because the there
Yeah.
is a lot of misconception about the inhalers, right? So for any allergic cough or any allergic kind of the disease, inhalers they are very good modern medication basically because they act just on the just on the target, right? So where we want the therapy, because it does not go into the blood. Systemic bioavailability is zero with the inhalers. So suppose if we give any tablet, it go in the blood, it excrete by the liver or kidney. So if we go for a longer time, the any tablets, it may cause the side effect. But if we give the inhaler, so what it does, it acts on the lower airway tract only, and it comes out while exhalation. So there is no adverse effect, right? But there are lot of misconception in the society, in the media, that inhalers may have the additive effects. It is having a steroids, or it may cause the lot of adverse effects. But it is not like this, because it is just having a local effect, like the skin ointment, like the nasal drop, like the ear drop. So it's similar with the inhalers. So there is, if the doctors prescribe you an inhaler, please take it in a judiciously way, because you have to take it, otherwise what will happen, your disease will keep on increasing, and one time you will require the oral steroids, and that will have some major side effects. So that's why my advice to every audience, and even the patients who come in my OPD, that don't go by the media or by your neighbors or by the community about the inhalers. Take it in a proper way what the doctor advises.
That is very true and fully justified. Moving on, we have Mrs. Nisha Gupta from Ambala. She says, सीढ़ी उतरने और चढ़ने के टाइम मुझे सांस लेने में दिक्कत होती है, सांस फूलने लग जाती है। मेरी एज 56 और वेट 87 केजीज है। क्या मुझे अस्थमा है या मेरा वेट इशू है?
देखिए, अगर आपको चलने में और सीढ़ियाँ चढ़ने उतरने में प्रॉब्लम है, तो इसका मतलब आपका वेट से रिलेटेड हो सकता है, क्योंकि अस्थमा एक ऐसी है जो कि जनरली चलने पे तो होती ही है, साथ में अगर आप सिम्टम्स एट रेस्टिंग पोजीशन पे भी हो सकते हैं। स्पेशली पेशेंट्स ये प्रॉब्लम करते हैं, या उनको ये बेसिकली कंप्लेंट रहता है कि जब वो नाइट में और मिडनाइट या अर्ली मॉर्निंग सो रहे होते हैं, तो उस टाइम उनको प्रॉब्लम ज्यादा होती है, ब्रीदिंग डिफिकल्टी की या खांसी की या व्हीजिंग की। बट अगर उनको नाइट में या पूरे डे में बैठने पे कोई प्रॉब्लम नहीं है और सिर्फ चलने पे है, और उनका वेट, इफ शी इज ओवरवेट और ओबीस, देन दैट कैन बी द रीजन। लेकिन इसके लिए शी शुड कंसल्ट द डॉक्टर, जो कि एक पीएफटी टेस्ट होता है वो करवाएंगे, एंड एवरीथिंग विल बी क्लियर विद द पीएफटी टेस्ट। बट ग्रोसली मुझे लगता है कि डेफिनेटली शी शुड लूज हर वेट, बिकॉज लूजिंग द वेट विल डेफिनेटली improve her BMI, and what will occur, that her muscles, respiratory muscles, they will act better or in an efficient way. So उनका जो breathing issue है, that will reduce significantly, और it may be she will be all right. तो बेटर ये है कि अगर एक बार वो डॉक्टर को कंसल्ट करें, और then they will advise the therapy, and she can do.
Absolutely. Moving on to one of the last questions of this segment. It is from Mrs. Indu from Punjab. She says, मेरे 2 साल के बेटे को ब्रोंकाइटिस बताया है डॉक्टर ने। मैं उसे नेबुलाइजर स्टीम दोनों देती हूँ। क्या ये बीमारी उसे लाइफ लॉन्ग रहेगी? वो कब तक ठीक हो पाएगा?
देखिए, ब्रोंकाइटिस पहले हम यूज करते थे, बट अभी हाल फिलहाल एस्मा जनरली यूज करते हैं। तो अगर बच्चे 2 साल का है, तो मोस्ट लाइकली ही इज हैविंग अस्थमा, स्पेशली अगर फैमिली हिस्ट्री भी है तो। अब दूसरी चीज जो क्वेश्चन है कि क्या ये लाइफ लॉन्ग की बीमारी है, यस, इन सम around 10% of children it may remain for a lifelong. 90% what happens that it is seasonal, or it may go by age of 10 to 12 year of age. So abhi just they should not make a panic, and they should act according to the doctor's advice. And moreover, they should give the time to the child for the time to heal, because what happens, the most of the allergic symptoms or the allergies can be settled by the age of 15 years. But in 10% of the cases, yes, it may go beyond 15 years, and it may cause a concern इंटरमीडिएटली, मतलब बीच बीच में हो सकता है कि उनको ये प्रॉब्लम आए आगे भी। बट अभी इसका कोई आंसर दे नहीं पाएगा कि उनको लाइफ लॉन्ग रहने वाली है, या फिर अभी ये फॉर कुछ, इट्स अ मैटर ऑफ सम टाइम। तो इट डिपेंड्स ऑन की फैमिली हिस्ट्री कैसी है। अगर आपकी फैमिली हिस्ट्री में अस्थमा है किसी को, या फिर ब्रोंकाइटिस की प्रॉब्लम है एंड फॉर अ लॉन्गर टाइम है, और अगर वो एलर्जी भी काफी ज्यादा है तो इट मे रिमेन फॉर अ लॉन्गर टाइम। अगर किसी को नहीं है और बच्चे को भी अभी जस्ट स्टार्ट हुआ है और वो भी एपिसोडिक है समटाइम्स एंड इट इज रिलेटेड टू दी कुछ खाने से हो रहा है, तो दैट इज नॉट अ बिग कंसर्न।
So here we have come to the end of this segment. Moving on, Dr. Pawan, we have seen a lot of advancements in today's technology. And one of them leading to respiratory cases, we have one of the biggest advancements, that is air purifiers. We have seen a lot of new homes, a lot of big homes having air purifiers in their home. Not only one, but one in each room. Do you support the use of air purifiers? Do you feel that air purifiers are really necessary and people should have it? And if it is so, people who cannot afford it, what they can have as an alternative?
See, this is basically a big query or big questions, and that is being asked to us in by mostly patients in our OPD. The air purifiers basically it purifies the air, no doubt. But the important thing is that it works only when you are in a very close compartment. If you are in a closed compartment, mean that your door and windows are closed and the air purifier is on, right? Then it will work definitely because there is no inflow of the air from the outside environment. So whatever air is in the inner circle or in the environment, that is get purified and is supplied to you. But suppose if you have on the air purifier and your window or door is open, so what will happen that the impure air will continuously will come and air purifier will not be able to purify at that speed. Any air purifier, if you close everything in closed space, then it will take around 3 to 4 hours for complete your room air to purify, depending on the size of the air purifier. But likely it is around 3 to 4 hours. So it only works when you are in a very close space. So I generally advise if the patients that you take the air purifier and you just use it when you are in a sleeping mode, because at that time the person spend around 7 to 8 hours in their home, right? Otherwise, what you does, either you are outside your home or whenever you are in, then you move in and out. So when you are in a sleeping mode, 7 to 8 hours in a room, so you just on your AC at a very comfort mode around 27 to 28 degree along with the air purifier, and you close your door and window. So what it will does that it will not only purify your air but also circulate your air well by the AC. So then it is okay. If you are not able to do this, then there is no use.
Plants are said to be the best air purifiers since very long time. So people who have big homes and they have a lot of greenery out there in their balconies, in their verandas, and in their garden, like lots of pots, flower pots, and everything. Do you feel that even that is fine in today's era?
Yeah, definitely. Plants um, there are good air purifier also, and especially the some indoor plants that have come, and that has the studies has suggested that they are able to reduce around 20 to 30% of the to reduce the AQI. So if you put the plant and you maintain it well, so your AQI of the room is, if it is outside around 400 and your room AQI without plant is 300, with plants, it will reduce to up to 220 or 200. So that is a significant drop in the AQI by indoor plants. So definitely I recommend this. The indoor plants, they are good and you can use if you are able to maintain it because they require a good maintenance also.
Absolutely. So, in today's time, we have seen a lot of mental health issues occurring. People are very vocal about mental health issues. But I want to know, is mental health, stress, depression, any ways in any manner connected to our respiratory health? Does mental stress affects our respiratory health, lung health, anything?
See, nowadays the big focus is on the mental health also because mental health is the one which is connected to all kind of the physical illness, right? So it is not that only you have the physical illness, But if your mental health is improper or you're under stress or under depression, so that is definitely added up your physical health. So if anyone, suppose if anyone has the bronchial asthma, and so if bronchial asthma, the stress or the depression is added comorbid factor. So whenever we take the history of the asthmatic patients, we generally ask about their stress level or their mental health status. If it is not, then definitely inhalers or whatever medications we are going, it is not going to work properly. So this is a major factor nowadays. Similarly, in the elderly populations, where now they are becoming more isolated or not, they are very uh, when they are dependent. So their depression issues are very high, and in these
Yeah.
patients also, we need to check their mental status. Until their mental health is not good, whatever medications they take, it is not going to affect much. So I think not only the respiratory issues, not only is some subset of the disease, but it is a global era where we have to deal the mental health first, and then we have to come to the physical health. So even if it is a heart-related problems or a nephro problems, mental health, especially the stress, it is going to impact their or it is going to surge their physical illness.
Absolutely. Sir, with this, we have come to an end of this episode. And by here, the viewers and listeners who have come till here of the episode, I do hope that most of their questions have been answered. उनके अंदर का जो रेस्पिरेटरी सिस्टम को लेके डर था, जो कॉमन क्वेश्चंस थे, जो हर घर में खांसी, जुकाम, सर्दी, चेस्ट पेन, इन सब को लेकर होते हैं, वो सब आज सॉल्व किए हैं आपने. I do hope, sir, you enjoyed the session and I look forward to have you on board once again.
Thank you, Dr. Anushruti. Thank you, audience.